Hello, wonderful staff of the Kent Northwest Kidney Center. Today we'll be talking about the itchy dialysis patient, that is pruritis among the dialysis population. This is a very common and terrible problem among our patients. It's a major cause of misery in dialysis units, and it can be difficult to treat. This is Dante, who was an Italian author in the 14th century. He wrote an epic poem called Dante's Inferno. The Inferno describes Dante's mythical journey through hell, guided by the ancient Roman poet Virgil. And in the poem, hell is depicted as 9 concentric circles of torment located within the earth, basically for people who were bad in life. And depending on what bad deed one did in life, you were assigned to a level of hell, 1 through 9. Those who committed the sin of falsification or lying were punished by the burning rage of fierce itching that nothing could relieve. The way their nails scraped down upon the scabs was like a knife scraping off scales from carp. Oh, you there tearing at your mail of scabs, and even turning your fingers into pincers. My guide began addressing one of them. Tell us, there are Italians among the souls down in this hole, and I'll pray that your nails will last you in this task eternally. Of course, itching has been with us for all of human existence, but it wasn't medically defined until 1660, when the German physician Samuel Hoffenreffer offered this simple definition. Itching is an unpleasant sensation that provokes the desire to scratch. Um, Itching is also known as pruritis, and pruritis is the Latin word for itch. Again, the sensation that causes a desire or reflex to scratch. Itch has been ranked by scientific and artistic observers alike among the most distressing physical sensations that one can experience. So why do we itch? Well, scientists believe that itch evolved in order to protect us from insects, from such dangers as mosquitoes, for example, that can carry malaria or yellow fever or dengue, from flies, which can be the source of tularemia, river blindness, sleeping sickness, lice, which can cause typhus, fleas, which can cause the plague, and of course, poisonous spiders. This theory goes a long way towards explaining why itch is so exquisitely fine-tuned. Think about this observation by Atul Gawande, the physician and author. You can spend all day without noticing the feel of your shirt collar on your neck, and yet a single stray thread poking out, or a louse's fine legs brushing by, can set you scratching furiously. There are actually several types of itch. Most commonly, an itch is felt in one place, which is a standard or a solitary itch. If it is felt all over the body, then it is called a generalized itch or generalized pruritus, and this is what we typically see in dialysis patients. If the sensation of itching persists for 6 weeks or longer, then it is called a chronic itch or chronic pruritus. Interestingly, there's also something called a contagious itch, in which itching and scratching can be induced purely by visual stimuli. That is, you see someone scratch or you see something that looks itchy, and then you start to scratch. This is similar to the contagious yawn, in which you see someone yawn and then you start to do the same. There's also something called a psychogenic itch, in which people itch because of a psychiatric disorder. For example, some people imagine that they have bugs crawling on their skin. And then there's something called the uremic itch, which is the subject of today's talk. There are 2 objectives in today's talk. First, we'll discuss causes of uremic pruritus or itching among dialysis patients, and then we'll review treatment options. Let's begin by discussing the prevalence of itching, chronic itching among dialysis patients. The reported prevalence of uremic pruritis, or chronic itching among adult hemodialysis patients, has varied over the years, and some studies suggest the prevalence may actually be decreasing with more effective dialysis. The upshot is that most studies suggest that it is very common. The reported prevalence between 1980 and 1993 was 50 to 90%. Subsequent surveys note a lower rate of 22 to 57%. In the DOPS trial, or the Dialysis Outcome Practice Pattern Study, which is International Multicenter Observational Trial of Dialysis Patients, reported the prevalence of chronic pruritus between the years of 2012 and 2015 to be 18%. A Korean study that looked at 425 hemodialysis patients and 223 peritoneal dialysis patients reported a higher prevalence of pruritus among PD patients than hemodialysis patients, so 63 versus 48%. Taiwanese study, however, reported less pruritus among peritoneal dialysis patients compared to hemodialysis patients, 28% versus 38%, and also lower severity of pruritus among the peritoneal dialysis group. So why does chronic itching or uremic pruritus occur among dialysis patients? The short version is that we don't know, although there are a couple of hypotheses. One is the immune hypothesis. Basically proposes that uremic pruritus is a result of systemic inflammation that affects the skin rather than a localized skin disorder. Evidence in favor of this, basically we have immunosuppressive therapy or immunomodulating therapies such as ultraviolet light or immunosuppressants such as calcineurin inhibitors that have been shown to reduce pruritus in some studies. And also dialysis patients have higher levels of inflammatory markers, and these are associated with pruritus in various studies. So the higher the levels of these inflammatory markers, the more likely it is a patient is to have chronic pruritus. There's also something called the opioid hypothesis of pruritus. Basically says that chronic itching in dialysis patients is a result of an imbalance in expression of two different types of opioid receptors, mu and kappa opioid receptors. Basically, mu receptors, when activated, and kappa receptors when blockaded, increase pruritus. In contrast, if you block the mu receptor and stimulate the kappa receptor, results in decreased pruritus. Evidence for this includes the fact that beta endorphins, which are mu receptor agonists, levels are higher than kappa receptor agonists, the dynorphin, compared with healthy controls. There are other theories too about uremic pruritus, including the fact that mast cells, which are these inflammatory cells inside of the skin, are more susceptible to releasing their histamine and other things that can make you itch. And finally, dialysis patients often have dry skin, and this can contribute to the problem. Now, there are many risk factors for generalized pruritus among the general population. These include an allergic reaction. So for example, that could be topical, like poison ivy, or systemic, say you eat something you're allergic to. Any number of arthropods assault, like lice, insect bites, scabies can do it. Herpes zoster, which is a viral infection of the skin. Dry skin, eczema can cause pruritus. Malignancy is also associated with pruritus, as can pregnancy. Polycythemia, basically having a high red blood cell count, as we talked about earlier. Psychiatric disease can make you itch, and a lot of medications, include opioids, can cause chronic pruritus. The main risk factors for pruritus among dialysis patients include inadequate dialysis, elevated phosphorus and parathyroid hormone levels, and dry skin. Pruritus in dialysis patients most commonly affects the back, but it can also affect the arms, head, and abdomen. Generalized pruritus all over the body is noted in a significant number of patients. Some patients experience pruritus only for a few minutes each day. Other patients have it nearly continuously. Symptoms are often worse at night, resulting in sleep disruption. Patients often report that the pruritus is worse when exposed to heat, and that it is often better with physical activity, cool temperatures, and cold showers. Sometimes it's worse with the itchy dialysis patients more often have high BUN, PTH, calcium, and phosphorus levels compared with non-pruritic dialysis patients and are less likely to have a PTH less than 200. All right, let's now talk about the management of uremic pruritis in dialysis patients. The first step is to optimize their dialysis and give them more dialysis clearance. So if your patient's getting off dialysis early, make sure they complete their treatment. It was a study published in 1995 in the American Journal of Kidney Disease. It was a 12-month prospective study of 59 hemodialysis patients who were stratified according to the degree of pruritus observed over a 3-month period. If the patients never had pruritus, they found that they had a mean KT over V of 1.31. If they had some pruritus, their mean KT over V was 1.28. And if they had prolonged severe pruritus, their mean KT over V was 1.09. In the second phase of the study, they took the patients who had severe prolonged pruritus and they assigned them to either receive more dialysis or the same dose of dialysis for an additional 3 months. And what they found was that the patients who dialyzed more had a significant reduction in pruritus of 77% compared to only 8% of those who received the same dialysis prescription. Another way to optimize hemodialysis and achieve greater clearance is to switch dialysis patients with pruritus to a high flux dialyzer. Allows for better clearance as well as fluid removal. Study by Chen in 2009 was a randomized double-blind placebo-controlled crossover study of 116 dialysis patients who were randomized to 12 weeks of dialysis with a high flux dialyzer as opposed to conventional flux, and found that a higher flux dialyzer resulted in a significant reduction in pruritus score compared to a low flux dialyzer. Second thing that you want to do to manage pruritus in a dialysis patient is optimize their phosphorus and their PTH. Chow reported a study in 2000 of 37 hemodialysis patients who had high PTHs and were referred for a parathyroidectomy. 22 of those patients had severe itching prior to the surgery. What they found was that the parathyroidectomy was associated with a significant reduction in pruritus, in addition to a reduction in calcium and phosphorus and PTH. Note, however, there are no data to suggest that parathyroidectomy is beneficial in the absence of a markedly elevated PTH concentration. So that's why we reserve parathyroidectomy for people with high PTH, hypercalcemia, as well as severe hyperphosphatemia that's refractory to medical therapy. Another important approach to managing chronic pruritus in a dialysis patient is topical therapy. Basically, the regular use of emollients, creams, lotions, basically for dry skin. Morton published a study in 1996 looking at 48 hemodialysis patients, 24 peritoneal dialysis patients, comparing them with age-matched controls, and basically prescribed to them regular skin lotion and creams for pruritic paste, basically water-based skin lotions. What they found was that dialysis patients overall had drier skin than controls. 27% of hemodialysis patients, 54% of peritoneal dialysis patients complained of chronic pruritus, and the regular use of a water-based lotion like an emollient resulted in significant reduction in pruritus and a resolution in pruritus of 9 in 9 of 21 dialysis patients. So essentially we recommend high water content emulsions to be applied to the skin of dialysis patients. Here are a couple of other studies that have basically shown the same. Papa published a study in 1980, uncontrolled trial of 25 dialysis patients. 16 patients reported significant relief, and 9 had complete resolution with application of skin lotion. Okada published a study in 2004 looking at 20 dialysis patients randomized to gel versus nothing and found a significant reduction in pruritus associated with the water-based emollient group. Other practical treatments for our patients include avoid excessive washing of skin. Dry skin basically secondary to soaps can exacerbate pruritis. Using a humidifier, basically increasing the relative humidity of indoor air during the winter, may be beneficial for people who are prone to dry skin. Avoiding skin irritants, basically a lot of clothing and cleansing products, too much soap, for example, can irritate the skin. You want to cover areas that itch. Basically, scratching, of course, makes itching worse. Topical steroids are effective if they've got inflammatory skin disease. So, for example, if someone has a rash over their dialysis fistula, we usually give them steroids to treat a topical dermatitis. And finally, a cool environment. It's actually fairly important. Basically, the use of lukewarm water rather than hot during baths and showers may be helpful. Application of ice to an area of pruritis is good topical treatment. Now let's switch gears and talk about second-line therapies for pruritis among dialysis patients. Oral antihistamines. Basically, these are thought to help itching by stabilizing mast cells. Mast cells are, again, these inflammatory cells in the skin that can release histamine, among other inflammatory chemicals that can cause pruritis. Examples include Benadryl or diphenhydramine or hydroxyzine. These are effective. Main side effects are sedation, can also cause confusion. So we definitely have had dialysis patients who have been prescribed these medications who have ended up in the hospital because of confusion. Phototherapy. You can actually take someone to a dermatologist's office where they can apply UVB radiation. So you can irradiate someone's skin. Basically, this is thought to decrease pro-inflammatory cytokine levels and also cause basically mast cells, again, these inflammatory cells, to basically self-combust. A study by ADA in 2005 looked at 10 dialysis patients who completed a 6-week course of UVB phototherapy for uremic pruritus, and 8 out of 10 reported significant improvement in symptoms. It works, but there are some major limitations. One is cost. I've never been able to get it covered by anyone's insurance, and worse yet, it's a risk of skin cancer as a consequence of UVB irradiation to the skin. So it's available, but it's not often used, and I'm not so sure that it should be used with the risk of skin cancer. Okay, gabapentin is an anticonvulsant, so an anti-seizure medication that is used to treat neuropathy and neuropathic pain. So a lot of our dialysis patients, for example, have diabetic neuropathy and take gabapentin. It's also pretty good for itching. Gunal published a study in 2004 as a double-blind, placebo-controlled crossover study of 25 dialysis patients that were randomized to first either gabapentin or placebo for 4 weeks, and then for the next 4 weeks you got what you didn't get before. So then the gabapentin group was given placebo and the placebo group was given gabapentin. Basically what they noticed was a significant improvement in pruritus with gabapentin, but not the placebo. Naney published a study in 2007, also a double-blind placebo-controlled trial. This was of 45 dialysis patients randomized to either gabapentin or placebo twice weekly. And again, the gabapentin was associated with significant reduction in pruritus. Nofal published a study in 2016. Well done, randomized double-blind placebo-controlled trial of 54 hemodialysis patients, again randomized to gabapentin or placebo, and once again gabapentin was successful in reducing pruritus, placebo was not. There's another anticonvulsant or seizure medicine. It's also used for neuropathic pain. It's called Lyrica or pregabalin. Study published in 2016 looked at 179 hemodialysis patients who were randomized to either Lyrica or pregabalin, Zofran or ondansetron, which is a nausea medicine, or placebo. And the only one that was effective in reducing itching was the pregabalin. Another study published in 2017 looked at 72 dialysis patients randomized to pregabalin or doxepin, and found that doxepin is an antihistamine like Benadryl or hydroxyzine. Found that pregabalin was actually more effective than doxepin in reducing pruritis. Another study in 2012 looked at 71 consecutive dialysis patients with refractory pruritis, basically pruritis that wasn't getting better with any other treatment. They were treated with gabapentin or Lyrica, and the patients who were intolerant to gabapentin were offered Lyrica. Gabapentin reduced itching in 66%, and then of the 21 patients who stopped gabapentin because of side effects, 16 were started on Lyrica, and Lyrica reduced itching in 81%. So the upshot is that Lyrica is a good option for itching if they can't tolerate gabapentin or didn't respond. Another medication that's been used for pruritis is the antidepressant sertraline. It's a study published by Chan in 2013. Basically is a retrospective study of dialysis patients with pruritis. It didn't get better with Benadryl and other antihistamines who were given sertraline. And basically, the sertraline seemed to be effective in reducing the pruritis. Another medication that's sometimes used is montelukast. It is a leukotriene receptor blocker. So leukotrienes are these inflammatory chemicals released from the body after they come in contact with an allergen or an allergy trigger. And this particular medication is often used for asthma, but it may also be useful in pruritis, uremic pruritis that's caused by inflammation. So here are a couple of studies. One published in 2007, a randomized single-blind placebo-controlled crossover study of 16 dialysis patients in which montelukast significantly reduced itching, 35% versus 7% by placebo. Another study published in 2017, 30-day randomized double-blind controlled trial of 80 hemodialysis patients given montelukast versus placebo. Same thing, the montelukast was much more effective in reducing pruritis. And they were well tolerated, no major side effects in that group. Okay, we talked earlier about the opioid theory of pruritis. Basically, stimulation of the opioid receptors may contribute to pruritis. So naltrexone is a medication that blocks the opioid receptors. Again, if you can block the mu receptors, maybe you can decrease pruritis. And that was demonstrated in a study by Peer, published in The Lancet in 1996, placebo-controlled double-blind crossover trial that showed that the administration of oral naltrexone significantly reduced pruritis among 15 CKD patients with uremic pruritis. Other studies, however, have shown mixed benefits with naltrexone. Naltrexone does have a number of side effects, including insomnia, anxiety, nausea, and headaches. And if you've been taking opiates, it would trigger opioid withdrawal symptoms, which are very unpleasant. There is a new medication that will probably be available through the Northwest Kidney Center soon. If I'm pronouncing it right, it's called difelikefalin. Basically, it's a peripheral kappa opioid receptor antagonist. And there was a recent study published in the New England Journal of Medicine. It's a double-blind placebo-controlled phase 3 trial of 378 hemodialysis patients who are randomized to IV difelikefalin 3 times a week with dialysis for 12 weeks compared to placebo, and noted there was a 37% reduction in pruritus scores among the difelikefalin group compared to 17.9% in the placebo group. Main side effects of this medication, diarrhea, dizziness, and vomiting. Again, it may become available to the Northwest Kidney Center in the next year or so. This is just sort of a graphic demonstration of the same. Basically, the pruritus scores fell a lot more in the difelikefalin group than in the placebo group. Okay, so those are the therapies that may be helpful. There is one therapy that should definitely be avoided in the management of chronic pruritus, and that is scratching. Michael de Montaigne was one of the most influential writers of the French Renaissance, and he phrased it best. Scratching is one of the sweetest gratifications of nature, and as ready at hand as any. But repentance follows too annoyingly close at its heels. In other words, you will regret scratching shortly after you do it because it only makes the itching worse. So, in summary, pruritus is very common among dialysis patients. It's associated with inadequate dialysis, dry skin, abnormal calcium phosphorus metabolism. First line treatments: optimize their dialysis, make sure they're completing their treatments, consider a high flux dialyzer, make sure they're doing a good job controlling their phosphorus and PTH, use lots of skin emollients. Second-line treatments include oral antihistamines like Benadryl and hydroxyzine, anticonvulsants, gabapentin, and pregabalin, sertraline as an antidepressant, and then opioid receptor blockers, naltrexone, difelikefalin. Of course, it's important to avoid scratching. Okay, it is time for the quiz. Question number 1, what is a contagious itch? The answer is the urge to scratch after seeing another person or bear scratching. Question number 2. What percentage of dialysis patients have chronic pruritus? So it's been variably reported in different studies, and it's a very big range, but it's anywhere from 20 to 80% of dialysis patients have chronic itch. Okay, what are risk factors for pruritus that are specific to the dialysis population? Inadequate dialysis, elevated phosphorus and PTH, and dry skin. Next question. What is first-line therapy for itching in dialysis patients? So you want to make sure that they're achieving optimal dialysis clearance. You need to control their phosphorus and their PTH and use lots and lots and lots of water-based skin lotion. Last question. Name a medication that is useful for treating pruritus in dialysis patients. So you should be able to name one, and if you didn't, please rewind to the beginning of this talk and watch it again. So there are several medicines that have been shown to be beneficial for pruritus in dialysis patients. Antihistamines like Benadryl and hydroxyzine, naltrexone, gabapentin, pregabalin or Lyrica, sertraline, montelukast, and difelikefalin. Okay, this concludes our monthly in-service. Thank you so much for your attention, and even more, thank you so much for taking wonderful care of our patients. Hope you have a great day.